Picture this. You're deep asleep when a bolt of pain rips through your calf, so sharp it drags you out of a dream and into a fight with your own muscle. You clutch your leg, gritting your teeth, waiting for it to loosen, but it only tightens, until finally it lets go and leaves you lying there, wide-eyed in the dark. And now you're afraid to close your eyes, because what if it happens again? You've told yourself it's just age catching up, but if that were true, why do some people your age sleep soundly every night? Why do they wake up steady while you start the day already in pain? The truth is, your body may be starving for something it once had plenty of, and when you put those missing pieces back, everything changes. Let's start with the first one, a nutrient that doesn't just protect your bones. It gives every step you take its strength. Calcium is probably the first thing you think of when it comes to bones, but here's what most people don't realize. It's also the spark that makes your muscles move in the first place. Every time you take a step, stand up from a chair, or climb a flight of stairs, calcium is the messenger telling your muscles to contract. Without enough of it, those movements start to feel heavier, slower, and less stable. Have you noticed yourself gripping the railing more when you walk upstairs, or feeling like your legs just can't push the way they used to? That's not always just age. It can be your body struggling without the calcium it needs. And here's the part that surprises many people. When calcium levels dip too low, your muscles can misfire, contracting when they shouldn't. That's one of the reasons leg cramps can hit in the middle of the night, even when you've been resting. Low calcium also makes your bones more fragile, so if a cramp knocks you off balance, the risk of a fracture is much higher. It's a double hit, pain in the moment, and the possibility of months of recovery after. The good news is, restoring calcium doesn't have to be complicated. Dairy is a classic source, but so are dark leafy greens like kale and bok choy, canned sardines with the bones, fortified plant milks, and even tofu. Most seniors need about 1,000 to 1,200 milligrams a day. But here's the key. Calcium works best with movement. If you're getting the right amount, but barely using your legs, your body won't send much of it to your bones and muscles. That's why weight-bearing exercises, even simple ones like walking or light resistance bands, make such a difference. But what if you're already eating plenty of calcium and still getting cramps? That's where the next piece comes in. Because no matter how strong your bones are, your muscles can still betray you if they can't relax when they're supposed to. And the mineral that controls that might be the one you've never paid much attention to. If calcium is the spark that makes your muscles move, magnesium is the quiet switch that lets them turn off again. Every step, every stretch, every time you flex your foot, magnesium is behind the scenes, making sure your muscles can contract and then fully relax. When you don't have enough, the signal gets scrambled. Your muscle might grab on and refuse to let go, locking you in that sharp, breath-stealing cramp that yanks you out of sleep. Have you ever had one of those nights where you didn't even dare to stretch because you knew it might trigger a cramp? That's what low magnesium can do. It's surprisingly common in seniors, especially if you take certain blood pressure medicines, diuretics, or acid reflux drugs, all of which can drain magnesium without you realizing it. Stress also burns through it faster, and let's be honest, getting older doesn't mean life suddenly gets stress-free. Some people notice a difference within days of bringing magnesium back into balance. They sleep through the night. Their legs feel less twitchy, less heavy. Even the restless, crawling feeling that makes you keep shifting in bed starts to fade. You can find it naturally in pumpkin seeds, almonds, spinach, black beans, and avocados. Or you can use supplements like magnesium citrate or glycinate, which your body tends to absorb better. But if you have kidney issues, this is where you need your doctor's guidance before making changes. Still, even if your muscles can finally relax, there's another reason cramps keep coming back. A reason you'll feel in your legs as trembling, stiffness, or weakness after standing too long. And it's not about your bones or your muscles this time. It's about the electrical signals that keep them working together in perfect rhythm. Potassium is the conductor in that electrical orchestra, keeping every signal between your nerves and muscles clear and on time. Without it, your muscles can contract when they shouldn't, or fail to respond when they should. That's when you feel the sudden tightening in your calf, the trembling in your thighs after standing too long, or the stiffness that makes every step feel heavier than the last. Have you noticed that sometimes a cramp will hit just as you're about to fall asleep, almost like your legs have a mind of their own? Low potassium can be a big part of that story. As you get older, it's easier to fall short on potassium without realizing it. Certain medications, like diuretics, can flush it out. Health conditions like high blood pressure or kidney problems can change how much your body can safely handle. And here's the tricky part. Potassium doesn't just help muscles. It also protects your bones by neutralizing acids that can slowly erode bone density over time. That means keeping your potassium levels healthy supports your stability in more ways than one. You can find it in foods you probably already like: bananas, sweet potatoes, spinach, beans, oranges, even a baked potato with the skin. Most adults need between 2,600 and 3,400 milligrams a day. But if you have kidney or heart issues, you need to work with your doctor to find the right balance. When your potassium levels are where they should be, your muscles fire more smoothly, your legs feel steadier, and those cramps lose their grip on your nights. So now you've got the three essentials: calcium for the spark, magnesium for the calm, and potassium for the control. But how do you bring them into your daily routine in a way that actually sticks so you can finally stop living in fear of that 2 a.m. wake-up call? That's where it all comes together. Think back to that night we started with, the one where the pain hit so suddenly it tore you out of sleep. Now picture lying down tonight knowing you've already given your body the three things it needs to keep that from happening. You've got calcium keeping your bones strong and your muscles ready to move. Magnesium making sure those muscles can relax instead of seizing up. And potassium guiding every nerve signal so your legs respond exactly when they should. That's not just theory. It's the foundation for walking without hesitation, sleeping without fear, and starting your day without that lingering ache. The next step is making it a habit, not a hope. It can be as simple as adding a few calcium-rich greens to your dinner, keeping a small bag of pumpkin seeds for an afternoon snack, or swapping one side dish for a potassium-packed sweet potato. And it's about checking in with your doctor, especially if you have kidney or heart conditions, so you can adjust these nutrients safely. The goal isn't just to stop the cramps tonight. It's to keep them from coming back month after month, year after year. If you've been living with these cramps for so long that you've almost accepted them as part of life, I want you to challenge that belief starting today. Your body has been asking for help, and now you know exactly how to give it. Share in the comments what you've tried, what's worked, and what you're going to start doing after watching this, because your story might be the one that helps someone else finally sleep in peace. And if you want more ways to keep your legs strong and your nights quiet, hit subscribe, because we're just getting started.